Sit.
Okay, so before I go in my patient's room, since she has bronchiolitis, she's on drop foot precautions, so I'm gonna want to put on a gown, then a mask, and then gloves. So that's what I'm gonna start with before I go in. And then for this, for the sake of this video, I'm just going to kind of hold my mask down so that they can hear what I'm saying. And then also, yeah. But normally in real life, I would not do that. So let's just make sure I'm tight like this. All right. Okay. Perfect. My mask I'm gonna put on, because that's the order. So yeah, I'm just gonna keep it down though in this video. And then gloves. All right, and then when I'm suctioning, I'm also gonna wanna make sure to wear eyewear, so, yep. Okay. All right, so before I go in my patient's room, I'm just gonna kind of peek in real quick and see. I'm gonna make sure that the situation is safe. I'm gonna kind of check the behavior of the infant, which it looks like she's kind of struggling right now, which is to be expected. And then just kind of the overall health, look at that. So yeah, it looks like she's kind of struggling a little bit, but I'm just gonna assess that. And then I have all my supplies, so I'm gonna take those in with me. So I'm just gonna knock. Hi, my name's Addie. I'll be your nurse today. How are you doing? Good, good. Yeah, it looks like your baby's kind of having a hard time, so I'm just gonna bring in my supplies here with me. Alright. So what are you guys here for? You're here for an ear infection and for bronchiolitis, right? That is hard. That is a hard situation. Let's look at this baby here. Hi, baby. Oh, she's so cute. I'm just gonna take care to assess the IV side at this time, which looks like it's warm, but nothing out of the ordinary. It's the same temperature as the rest of her skin. It looks like it's not red or irritated or inflamed or anything, so that's good. That's what we're looking for. And then I'm just, yeah. So while I'm just kind of assessing this baby, I'm just gonna talk to the family. I'm gonna explain some of the doctor's orders. So do you guys have any questions or anything? No? Okay. That's okay. I just have some interventions because it looks like she's kind of having a hard time breathing. So while I'm here, we're just gonna kind of do some assessments, do some interventions, and then we'll go from there. So just let me know if you have any questions. That's what we're here for. I'm just gonna bring my doctor's orders over here as well. My little vitals cart and everything. Alrighty. Okay. So the first thing I'm gonna want to do is just kind of look at Addie's level of consciousness. So she looks like she's pretty aware. She's kind of looking at me. She knows that her mom is here. She obviously can't talk back, and she probably doesn't know where she is either. She's probably confused, but she looks oriented to the appropriate age that she is. And then I'm gonna look at her eyes. So I'm gonna grab my pen light. I'm just gonna say my paper. Oriented, and then I'm just going to kind of look in her eyes to make sure that her pupils are equal, round, and reactive to light and accommodation. Oh, she likes my green light. She's following it with her eyes. There you go. Okay, she's so cute. And then let's see next. We're just going to kind of assess that. I'm going to go through and just kind of take. I'm just going to take this off. Sorry, it's going to make baby kind of cold here. Sorry, baby. And I'm just going to assess for her femoral pulse, which it looks like it's palpable, so that's good. And then I'm going to assess her brachial pulse as well, which it looks like they're both equal bilaterally, so that's exactly what we're looking for. And it looks like her muscles are both equal on each side. She's kind of flexed right now. She'll be in some pain. I'm just gonna assess her head. Mom, it looks like she's a little bit dehydrated, which it totally makes sense. That's hard with her disease process that's kind of going on. But just at home, the infants, this is kind of part of my patient teaching as well, is they can have commercial formula and it has all the vitamins and minerals they need up to 6 months of age. But kind of right around now is when you want to start introducing different foods and stuff, just kind of slowly into her diet. But yeah, dehydration is a big thing. So we're just gonna kind of give her some fluids today just to make sure that she can be adequately hydrated and to kind of thin her secretions and help her mucous membranes to be hydrated and such. So I'm just gonna kind of assess her abdomen. Like there's not much distension there, that's good. And then I'm also gonna assess for cap refill, which I could do on her finger, or because she's little, well, that works perfect on her finger. It's less than 2 seconds, so that's what we're going for here. Just wonderful. Beautiful. And then also while I'm here, I'm just gonna assess her cough and then her respirations, and for cyanosis. It does look like she's a little blue, probably because she's less oxygenated, so we're gonna wanna watch that because she's a little blue baby. So, yep. And now I'm gonna take her vitals. So she's not gonna like me very much, but that's okay. Alrighty. And before I take her vitals, I'm just going to take her occipital frontal circumference because she's a little baby, so we do that with our little babies here. And do you have any questions or concerns about that, Mom? Okay. So, let's see, she's 37 for occipital. Alrighty, baby. Okay. And then we're also gonna take hers around her chest and then around her abdomen. And then I'm gonna just take care that I don't do it over her diaper or anything. So sorry, baby, we're just gonna take these off really quick. She's such a good baby. Okay. So, alrighty. We'll take it around, let's see. Okay. Alrighty. Okay. And make sure that her clothing isn't around it. Okay, that's about a 36, and I think that's probably to the best measure that you can. So that's around this diaper, but we're not gonna want to measure under the diaper or over the diaper either. Okay, make sure to do under the diaper and just kind of over the umbilicus. That's 36. Awesome. She's looking good. We're gonna try to keep her warm. So, alrighty. So for the occipital frontal circumference, 37, and then for the abdomen, 36, and then for the chest is also 36. So, just gonna button her back up here. Alrighty. Alrighty, baby. Okay. Now we're just gonna take some vitals. So, we put on this blood pressure cuff. Okay. Doesn't go super well on our little baby's arm, but goes good enough. And then we're gonna take that. I'm gonna put an oximeter on the hill, so which is typically the place. And then also, when I came in, I realized I was talking to the mom and baby like I already knew who they were, but I'm gonna just make sure that my patient is the right patient, which she is, Addie, so that's perfect. We're gonna put this on her foot. And sometimes the RT does this for oxygen, but sometimes the nurse does, so just depending on what facility you're at. I'm gonna put that back on for baby. Alright, we'll warm it back up again. And then we're gonna take her temperature. So, and this is just gonna be auxiliary. Right there. Alright. And then, yes. So, alright, let's see. The first time we just took her vitals, it looks like her heart rate is at, let's see. Well, we haven't done the heart rate yet, or respiration, but it's okay. So for her blood pressure, it's a little bit high, even though she is dehydrated. It's 110 over 75, probably because she's in some pain. Her temperature's a little high, so Mom, just so you know that normal blood pressure for a baby should be, for her age for 6 months, should be 80 to 100 over 56 to 66. But her blood pressure is 110 over 75, so yeah, a little high like I said. Temperature is 36.5 to 37.5 degrees Celsius. She's at about 38.2. She does have a little fever going on. And then I'm just going to listen to her lungs and look for retractions and such. As I do this, just before I do some of my interventions. So I'm going to want to listen to 5 points, which sometimes is hard on a little baby just because their hearts are so small. You can do aortic, pulmonic, Herb's point, tricuspid, and mitral, and then I'm going to listen for a full minute to her heartbeat and count it. Okay, we're going to pretend that's been a full minute, and then I'm going to listen to her lungs as well. So I'm going to count her respirations for 1 whole minute, and then I'm going to listen to her lungs right here. So we'll go 1, 2, 3, 4, 5, 6, get all the lobes, and then I'm just going to turn the baby on the side. Oh, good job, baby. I'm just going to listen to her on her back and all 6 lobes. 6. Normally that should not come unconnected. Don't know why I did that, but I'm just gonna kind of put it back into. But if it did, if her IV actually came out, then I'd redo the IV, or contact the physician, the doctor. But normally it shouldn't come out of the tubing like that, so I think that's just a little flaw of the moment. That's okay. Alright, so, okay, good job, baby. So looking at her heart rate and her respiration rate, looks like her respirations are kind of high. They're 70, so she's kind of having lots of labored breathing because they should be 30 to 45. And then her heart rate is 140, so that's a little bit high too. Okay, and then her oximeter is telling me that her oxygen's at 86. Okay, so she is a little bit less oxygenated. She's kind of struggling to breathe. So the first thing I'm going to do is I'm going to put on some oxygen for baby per the order. The oxygen, I'm just going to start her at 2 liters because she's kind of under. She's having a hard time breathing. So we're going to make sure to do that. So I'm going to hook up the oxygen to the wall and then put it on 2 liters. We're just going to, okay, little baby. And then this is just another kind of patient teaching and skill teaching for mom at home. But if you do have to give the baby oxygen, you're going to want to make sure that the prongs are down so that the oxygen can go into their lungs. Which this baby sometimes doesn't really have open nasal nares. So I don't know how it's going to go. But you're also going to want to put it on in this way so that it doesn't get tangled around their neck or anything. So let's see if this will go in for me. Normally it would go in their nose. That's great. Okay, perfect. So we're gonna put her on 2 liters. Okay, so she's on 2 liters of oxygen. Just gonna write down the time as well. So 8:45. Alrighty. And then I'm just gonna give her a bronch score and do some other pain scores before we get going. I just wanted to make sure she had the oxygen first. So, today for doing the pain score, I'm going to do a FLAC scale. So what that is because we're going to use this pain scale because she can't like communicate with us, mom. Like you've seen, she's probably in a lot of pain, but she can't tell us that. So I'm just going to look at her. So for the FLAC scale, let's see, we're going to look at. She's having kind of quivering in her jaw, clenched jaw. She's kicking up her legs. Let's see, she's kind of squirming and shifting back and forth. And then she also moans and whimpers and has an occasional complaint. So we're going to say she has a FLAC score of 6, so she is in some pain. So we'll do some things to help her with that. And then also while I'm doing this, I'm just going to kind of assess her speech and her cry. It looks like she does have a healthy cry. She's kind of sad today, which makes sense. So we're gonna just look at that. It says for her speech, which is appropriate for her age. Appropriate for age. And then we're gonna do a coma skill. So that's gonna tell us a few more things for the physician. So it looks like we already did her perla. Her eyes, she's opening to speech, so that's a 3. She's kind of has abnormal flexion, so that's another 3. So 6, and then she's pretty agitated and restless. So we're gonna give that a 2. So we're coma skills an 8. All right, and then that looks like she's a little dehydrated, like we were talking about. She's not super content, but that's okay. We'll kind of get her content in a second. And she is oriented and alert. So the next thing we're going to do before we do our other interventions, we're going to do a bronch score. So that's just because of her bronchiolitis. So the first bronch score she's going to receive, let's go off her vitals and off her observations, is she has more than 65 breaths per minute, so it's a 3. And then she does, based on what I'm looking at, is she's having some inspiratory and expiratory wheezing, so we're going to give that a 2. Her retractions, as noted, she's having them in 2 locations, intercostally and then subclavicularly, just based on what I was looking at her observations. And then, so that score is going to be a 7, so that's kind of high, so pretty severe. So we'll get her started on these interventions. All right. So the first intervention we're going to do is we're going to start with some nasal suctioning. I'm just going to start with the least invasive method first because that's the way that you should work. So we do bronch score, and then we're going to suction. All right. So I'm going to put these glasses on and make sure my mask is on because since she's on droplet precautions when I do that, I want to make sure that that's what I do. All right, so I'm going to squeeze. I'm going to get in her mouth first. And then, Mom, when you do this at home, make sure that you don't squeeze this into her mouth because that's going to push her secretions down and maybe block her airway, which her airway is really, really small right now. So you're just going to want to kind of take care of that when you're suctioning her at home because, you know, kids get little colds all the time. So do that. And then I'm also going to want to look at her nasal flaring per order, but it looks like she's doing okay. All right. Okay, so now that intervention's done, we're just going to listen again. I'm going to take off my glasses now. And then we're just going to assess her bronch score again and see if that intervention helped at all. And then I'm going to listen to her heart for 1 whole minute again and to her respirations for 1 whole minute because we want to see how that intervention helped. So listening to the heart for 1 full minute, listening to respirations for 1 whole minute. Okay, and then I'm also going to assess her to see for retractions, things like that. And it looks like after our suctioning, if we do another bronch score, let's see, her second heart rate was at 126 beats per minute, and then her respirations were at 62. So that did help some, so that's great. Let's see, so she's going to still score at 2. Respiratory rate, let's see, and then she's still having some inspiratory and expiratory wheezing, so the albuterol will help her. And then she is having some retraction still, so she is at a 6, which is just fine. We're going to get her kind of helped, and I'm going to keep that out too on her. All right, Mom, so the first thing we're going to do, after make sure that baby's cozy, is we're going to provide some albuterol, and then we're going to leave that on, so we're going to take that again. All right, so I'm going to go to my medications. I'm going to get my albuterol treatment. So what this is for, it's going to kind of help open her airways a little bit, help her breathe a little bit easier, and you can put this on with oxygen. A side effect of albuterol is that it will raise the heart rate. So when it does do that, we don't want to be super concerned, unless it were to be like crazy, but she should be okay. But yeah, when the heart rate gets raised, don't be alarmed. That's a normal thing that is expected. Just a side effect. So we're going to put this on, and the treatment should last about 15 minutes. So we're going to leave that on, and then it has fluid in it, so you're just going to want to do it until that fluid is mist, or there's no more mist at all either. Okay, and that's good that the suctioning worked before, because that means we don't have to put in an NG tube. Alright, but if the intervention didn't help and if it didn't get out all her secretions, then we would do that. Just to kind of suction some more. So So we're gonna put on that albuterol treatment, and then I'm just gonna do tick, tick, tick of the clock, and now the albuterol treatment is done. So we're gonna take this off. Good job, baby. It looks like she is breathing a little bit better. I'm seeing that she doesn't have really nasal flaring anymore. That's a good thing to watch for. I'm just gonna kind of take this to start up that. So, get that all over. So we're gonna do just another bronch score after our interventions because we want to make sure that they are actually working. So I'm just gonna listen to her heart again, and I'm gonna count her respirations again. So for 1 full minute, and then for 1 full minute again. And I'm gonna also assess her cyanosis and her cough right now as well. And it looks like she's still crying, so she's still having a hard time, but she's gonna be okay. So the bronch score after this, let's see, she, in assessing that just now, her heart rate was at 145, which is a little bit high, but like I said, that's to be expected with the albuterol treatment. And then her respirations are at 50, which is perfect. That means that the albuterol is working great. And obviously she's not like exactly where she should be, but she's getting a lot better. So that's really good. So let's see. So she has score 1 right here. For wheezing, she just has expiratory wheezing now, and then she only has 1 retraction instead of retractions in 2 locations. It's just intercostal retractions. So she's still using some accessory muscles to breathe, but she's doing okay. So that means her bronch score's at a 3. That is so great. So now that her breathing is established and her airway is more patent, we can do our other interventions. So next thing I'm going to do is we're going to assess her pain and her well, she's in pain, as we said, and her temperature is a little bit high, so we're just going to administer some acetaminophen. So I'm going to make sure that I'm giving this for the right reason, which is her fever, right time, which is based on my doctor's orders, just every 6 hours as needed, and then right patient, which is Addie, right time, right reason, right route, which is oral, PO, right amount, and then right dose, right route, right time, right reason, right patient, right medication. So we are all right on this. So you can just kind of put it into her cheek on the side. So this baby's mouth doesn't open, but I'm just gonna put it in her mouth kind of slowly so that it doesn't obstruct her airway or anything like that. And then just gonna administer that. So I'm gonna write that down and note the time as well. I'm gonna say right now it's like 8:55. 8:55 for the acetaminophen. All right. And then the next thing we're going to do is we're going to give her the ceftriaxone. So that's for her. Oh, and also, sorry, I neglected to say the side effect for acetaminophen. So with her, you're going to want to watch her kind of liver labs and levels, her enzymes and stuff, because acetaminophen is metabolized by the liver. And since she's so little, you don't want to give her too much in a day, just because that could kind of have, that's contraindicated and stuff and can cause some like hepatic damage. So you're just going to want to watch that at home as well. And then also with her, because she's dehydrated as well, her potassium is probably going to be a little bit high and her sodium. And then also her CO2 is going to be a little bit up just because of the of how she's breathing. And it looks like her oximeter is telling me that her oxygen is now at 90. So that is great. That is really great. And we want to kind of keep it in the 88 to 92 range just because of the nature of her disease process. All right, so the next thing we have is our ceftriaxone for her otitis media. That's her ear infection. So ceftriaxone is an antibiotic. It'll help treat that. It's just once a day intramuscularly, like we were saying, right route, right dose, right time, right reason, and things. And then I'm just gonna alcohol swab this off. We're gonna want to give it in the vastus lateralis, so just the side of her leg. So I'm gonna just alcohol swab this little leg off over here, but I'm gonna give my medication here for today's purposes. Throw that away. And then I'm gonna want to give it in kind of a dart-like motion. So, yep, and I'm gonna just assess its the right amount again. Yep, just already know. Alright. And then then since she's such like a little baby, we might want to use a smaller needle. But for today's purposes, since I'm doing it on this, it's okay. And then we'll cap that, and we're going to toss this in the sharps container. So, sharps. Alrighty. So now that's administered. And then the next thing we're going to do is we're going to do her fluids. So, and also a side effect of that antibiotic is that antibiotics tend to cause a lot of GI upset and such. So if she has diarrhea, if she looks a little bit extra distended or hard in her abdomen, that's totally okay. That's something that's to be expected, so don't worry about that. I'm going to grab some alcohol swabs, and then before I give my solution, I'm always going to want to make sure to flush. And then at the beginning of my video, I don't know if I talked about how I was washing my hands before I went into the room, but I did that as well, so I just wanted to clarify that. Alrighty, so we're going to want to make sure that this is the right stuff. So first we're going to start with the bolus, and that should administer over a 15 to 20 minute period, just as fast as possible. So here's our sodium chloride bolus solution. Make sure that's right. It's already set on the right rate at 136 milliliters per dose. And then let's see. So we're always going to want alcohol off each of the points. More so her IV, because this one should have a cap on it, but this one doesn't, so alcohol swab it too. I'm going to hold this. And then I'm always going to want to flush to make sure that her IV is patent and to make sure that it's not kinked or anything. With her, since she's so little, I don't need to do like a whole 10 milliliters or anything like that. I could just do even like 2 and it'd be just fine, because we don't want to give her a ton of fluids at once, because that also wouldn't be positive. So I'm gonna put that in, and then I don't know if this is gonna bleed out because of our, not bleed out, but just come out. So we'll kind of assess that patency. Beautiful. Okay, it looks like her IV is patent. So we're gonna take that off, and then I'm gonna put in the bolus. So it should run over a 15 to 20 minute period, like I said, and this is just for her dehydration, because she's dehydrated, and we want to try to thin those secretions. Alrighty, so I'm going to get another alcohol swab, because I'm going to just put up her normal maintenance IV fluid right now as well. It has some dextrose in it, so we're going to do that, and then wait for that to dry and get this set up in our machine. And it looks like that's set to run at 27.2, which I know is the right dose. Level of fluid, and then I'm just going to assess this IV port to make sure it's also patent. So we're going to put in about, beautiful, okay, that's working just great. Alrighty, so that one's patent as well, and that was like new flush, so that's okay. Or the same one, as long as it's still sterile. And then we'll put this in, there you go, little lady. Okay. And then we're gonna take this, I'm just gonna pull this away. Alright, it looks like as assessed, her breathing is a lot better. I'm just gonna throw this away, but put it back so someone else can use it for the next video. But anyway, so it looks like based on the evaluations, her bronch score's a lot better, her vitals are better, her oxygen is up. I'm just gonna turn it down to 1 liter, because we want to kind of taper her off that gradually. So we're going to turn that down 1 liter, and then we're going to say now it's like 9:15. So 9:15, 1 liter of oxygen. And then, yeah, so those should be all, that should be all of our interventions. And it looks like she is doing a lot better than she was previously. So, just like I said, we kind of already went through some of the skills, so I'm not going to go through those again, but if you, just because you have no questions, Mom, but if you did have questions, I'd be sure to help go through other things. And then I'm just going to take her vitals one more time. So we're going to do her blood pressure, and then I'm just going to listen before I go. I'm going to listen to her heart rate, watch for retractions, listen to her respirations, and then I'm going to leave the oximeter on so that it can alert us if her oxygen suddenly takes a dip or anything like that. But perfect. And so I'm going to take this off, and it looks like at the end, her vitals, and then also I'm just going to take her temperature one more time to see if the acetaminophen is kind of helping yet. And take that. Okay, perfect. So, and then, let's see. At the end, her vitals, her heart rate is at 138, so that's okay. That's a little bit down from last time because of the albuterol. And then her respirations are at 50, which is perfect. Her blood pressure is at 105/70, so that's a little lower. That's just fine, and that's okay. It might be kind of fluctuating just because of her fluid and her dehydration and her pain. So that's okay. That's just great for blood pressure. Her temperature's at 36.9, so that's coming down. That is working. And then her O2 is at 90, so perfect. All right. Mom, just let me know if you have any questions. I'm just gonna take my things and make sure that it's cleaned up in here for you guys, so I can leave you in a safe environment. And then, do you have any questions for me, Mom, before I go? Okay, well, I think your baby is just the cutest, and she's gonna be okay. We're gonna make sure that she's warm. I'm gonna take that out when I go, but yep, and our IV fluid's all hooked up. So if you have any issues or any other questions, just be sure to let me know and we'll be around. So then, I'm gonna leave my environment safe, my patient safe. And clean. I'm gonna take out my vitals card and everything else, and then I'm gonna take off my gown and my gloves and such, and then I'm gonna perform hand hygiene. So I guess, I don't know if this needs to be in the video, but yeah, just take off my things, discard of them, and then perform hand hygiene and everything. So here we go.